I'm sure many of you have had to try to work through pain. I today have had to do the same thing. One including some back pain, and also what I'm really surprised a lot of people don't recognize. I think athletes might have an advantage of understanding the delayed onset of muscle soreness and doing a different workout that I'm used to and ending up with some significant pain in my glutes and legs a day or two later. And the first thing you want to do is do nothing, which, it might be okay for a little while, but moving is not necessarily going to harm you. It doesn't feel great, but I just start out trying to be gentle with myself initially, and I just went outside. I'm right in the middle of a jog, walk, run type of combination workout today, but I think we have to think about how we approach working through pain in a healthy way. And a couple things we need to remember is sometimes there can be acute pain, and there's a real good reason to have a physician evaluate you and make sure there's not a significant issue. However, there can be a lot of reasons, and underuse, overuse, how we're thinking about the situation. If you tend to be an optimist and you have an optimism bias and you tend to never think anything bad, or don't want to believe that something bad is going on, and kind of a denial or don't want to deal with it, that has its own repercussions. And then there's people that tend to be more can't really let go of the idea, maybe a little pessimistic, or perseverate, or continuously think about things or worry about things, and make a mountain out of a molehill, so to speak. And that can have an impact on how you're thinking about your pain. It might make you avoid the pain. It might make you constantly seek additional help outside of maybe go into the medical field, and may get things you don't need. But I just think it's fascinating that really pain is about exploring and understanding it. But the more you understand the body and how amazing it is and how it works, and there's still a lot for us to learn, even in the medical field, and how amazing it is. But if you don't learn to understand it and explore it and recognize that your attributions or assumptions of what's going on could be wrong, whether you're a clinician or a patient who's dealing with pain, we can get trapped in that one belief or assumption. So, and just to give an example, I've had occasions where I'm always amused by adults that, like an adult female goes to the emergency room who is worried about some lower abdominal pain, but it turns out it's just abdominal, menstrual cramps, and they didn't put two and two together. Or someone who's had a toe injury and thinks that Google gave them their answer, and they don't have the perspective of someone who can deal with acute injuries, and assuming that it's a broken toe and buddy splinted it with another toe, and then end up finding out later, when it doesn't get better or it's still hurting, that it never healed right and it actually was dislocated. Totally different approaches in how you treat things. So I just wanted to remind myself and everyone else that sometimes you have to work through pain, and as long as it's not something acute, concerning, and you've learned that about yourself, and the attribution is positive and correct, then working through it and not avoiding life and activity and things that bring you joy is a really good, important lesson for all of us to learn. So I just wanted to remind you to challenge your health, or challenge your mind before your health or your mind challenges you. And sometimes pain can get in the way in life, and we all experience it, at least almost all of human population. There are a few people that can't experience the traditional kind of pain, but that's for another talk. So until next time, I'm Melissa Cady, the Challenge Doctor. I hope you all have a wonderful week going into 4th of July for the States. Talk to you later. Bye-bye.